Good morning. It's another time with you, our health talk again. We'll be talking about cervical cancer. Do you know that cervical cancer is the second most commonest cancer among female, even here in Nigeria? It's about 10 to 7%, and many people do not know that. Have you heard about HPV vaccine? HPV is human papilloma virus. It's a vaccine we give to prevent this cancer. So I would like to talk more about that. What is cervical cancer? This is a cancer that affects the female reproductive organ. It affects a part of the female reproductive organ called the cervix. So it affects the cervix, and after a period of time, this cancer will begin to affect the whole part of the body. And just like anything cancer, you know that it is deadly. So how do we prevent this? What is the way out? What are the risk factors? How do you manage it? Those are the things we will talk about today so that we'll protect ourselves. Early sexual intercourse among children, early marriage, multiple sexual partners, husband of multiple, a lady having a husband that has multiple sexual partners outside. Of course, the lady might not have a multiple sexual partner, but if the husband is having multiple sexual partner, such husband can also bring trouble to the woman at home. So having multiple babies too, having multiple pregnancy, multiple childbirth, cigarette smoking, family history. When there's a family history of cervical cancer, it's also very important. It is common among Black people. Low socio-economical factor is also one of those factors. So all I've listed, highlighted are the risk factors one has to look out for. So these are the things you need to be aware of if you are going to prevent yourself from having this. So they are the risk factors. So the next I'll be going to, what are the signs and symptoms that you will see? First is pain during sexual intercourse. Before I start with that, I would like to say sometimes it is asymptomatic. You might not have any symptoms. It will just be through screening. So that is why screening is very important. Early, you might not have any sign, anything to note, but during the course of the screening, you would realize that, oh, this thing is there. So early detection will save life. Then the second one is a pain during sexual intercourse. Bleeding after sexual intercourse. Pain, intermittent bleeding from the vagina. You start realizing that you are not doing your menstrues, you're having intermenstrual bleeding. Bleeding can be coming from anywhere. You need to rule out that. So you can start having weight loss. You realize that you're losing weight. You also realize that you have difficulty easing yourself, pain when easing yourself. You urinate frequently, because when the cancer is there, it affects other structures around it. The urethra, that is the pipe that brings out urine from the bladder, is also around that place. So you'll be having frequency signs of infections. You'll be having foul smelling vaginal discharge. The discharge that will be coming out will be smelling such that people will be wondering, where is this smell coming from? So those are the signs you will see, and early detection, like I see, will save life. So there are many others that I will not be able to mention, not because they are not there, because other people might present differently, but they will show that these are the signs of cervical cancer. Cervical cancer cannot hinder you from getting pregnant. But if you are pregnant and you realize that you have cervical cancer, the cancer will compete with the baby, so you have to stop the baby. So the peak age is around the age of 51.4 years. The peak age for cervical cancer, let me say, it's around 51. Well, however, that's the peak age, but it doesn't mean it cannot be picked for someone lower than that age or higher than that age. So you need to be watchful about that. So it cannot stop you from getting pregnant, but you can be pregnant, and if the cancer is coexisting, so there will be two competition. The cancer will need more blood supply, and the baby also need more blood supply. Well, cervical cancer patient can eat any food. Looking at the cause of cervical cancer is not food related. You can eat everything every other person eats. But you just need to see your doctors, ensure you are not taking, generally when you have cancer, you don't take folic acid because it promotes the growth of cancer. So the only medication you need to run from is don't take folic acid because it can just promote the growth of the cancer. So those are the things you need to know. Some think it's a spell, maybe juju or diabolical power. You say, Yoruba will say, "Where I want to saw any on lota," that it's the power of the enemy. Yet, but in reality, it is something you need to check out. So many people will say, "Oh, God forbid, I can't have it." You know, I've seen patients come in, and when they tell them that this is what is wrong with you, I have a patient recently that came in, and the patient was having pain during sexual intercourse and bleeding after sexual intercourse. The bleeding was bleeding profusely that she had to be using excessive pad to cover up. Yet, so she believes that it is nothing, that she declined treatment, and she said she would go back to her village, that there are some herbal medications that you use. You know, I've come across people that will tell me that there are herbal mixtures they will insert into their vagina to help them heal up the cervix. So these are certain things people think about, and inserting some of these herbal mixtures or a lot of condiments would cause more problem, will aggravate the condition. So it's not, yes, there can be spiritual problem, but when you have cervical cancer and you have gone to the hospital and the hospital has done a pap smear test for you, you need to watch. You need to concur with them and listen and take the treatment the way it has been. So how do you prevent cervical cancer? By doing, the first thing is ensure you do your pap smear. Pap smear is very important across all. If you are already sexually exposed, go and do your pap smear. Across all ages, go and do your pap smear. So after the pap smear, the result of the pap smear will tell us what to do thereafter. If there is nothing, they need to be immunized. Immunization is good for ages between 9 and 14 because that is the age where the vaccine will work more. The functionality of the vaccine will be higher compared to older generations. So for those that are early, for your 9 to 14 years old children, they need to be vaccinated, female children, because a lot of things happens to children you don't know. God will protect our children. However, I'm not saying someone will rape them or they will have early sexual, but prevention is better than cure. Just like you have every other vaccines during childhood till the first year of life, the same way you should also be able to vaccinate your children against cervical cancer. And for those that are beyond and that are older, that are already having children, they have their partner, they should also do well to go and do their pap smear test. It is very important they do that. So that is the best thing you can do for yourself because early detection will save life. Like I said, sometimes you might not have any sign or symptoms, but if you pick it on time, treatment will begin on time and you will be secure. There will be better outcome with early detection rather than coming at a later stage when it is already becoming very symptomatic and there's little or no nothing we can do to do that. So there are different modalities of treatment. So we have radiotherapy, chemotherapy. In fact, you can even removal of the whole reproductive organ, the uterus. Total abdominal hysterectomy is also an option, and among many other things one can do, depending on the individuality of the patient and the progress of the disease condition. So thank you very much for your time. Today we have talked about cervical cancer. Our women out there, our mothers, our sisters, please, I want you to ensure you do your pap smear because you are our generation. The men are not the one delivering. You are the one that will carry the baby for 9 months. So take care of yourself. Ensure you go visit the hospital, do your pap smear test, and follow up with your results. If you need to be treated, be treated. So thank you very much. If you have any questions, if you have any questions, do well to reach out to us on our social media platform and on our phone numbers. We'll be happy to receive your questions. Do have a lovely day ahead. God bless you.